One of the procedures I perform very often, and I just did a couple days ago, is correction of traction alopecia. So the term traction alopecia means that when the hair has been braided or tightened too much, it loses its blood supply and then dies permanently, and you lose that hair. This is classically in African American women, specifically in the frontal temporal region, in other words, along their hairline. They have permanent loss in this area. And with that loss, they need to wear hair extensions or wigs to try to cover it and style their hair in a way to mask it, but they don't have the hairs there. The good thing is that the technique to correct this with a hair transplant is actually incredibly easy and fruitful and very beneficial. So I perform these all the time. And if the donor hair is adequate, you can actually move that hair into the front and transplant it with great success. There's a fear that somehow traction alopecia is a scarring type of hair loss that would lead to poor results, and actually there is no scarring. It's just the hair fibers die, or the hair shafts die. So the transplant is as successful as any other type of transplant in the frontal scalp. The one exception to this is misreading it and thinking it's traction alopecia when in fact it's masquerading as traction alopecia, when in fact it is actually a scarring type of hair loss. So African American women in particular have issues with a condition called central centrifugal cicatricial alopecia, or CCCA. And in those cases with CCCA, it could look like traction alopecia, but it's not. Some of the clues that you'll know that it's CCCA, which would have less favorable outcome, would be loss in the crown. And you say, well, wait a second, isn't that just normal loss in the crown? Well, sometimes there is this sheen look that is also involving the crown. So when I see this crown loss and frontal loss, I have a high suspicion or a low threshold to look at a biopsy to make sure this is not some other type of scarring hair loss that's masquerading as it is. Or there's this shiny look, as I mentioned, where you have a loss of the pores that would indicate it could be something else going on. Or there could be some burning, itchiness, or other types of abnormal skin conditions that would tell me, hey, watch out, this is actually another problem happening. But if you rule that out and the patient says, hey, I overpulled my hair many years ago, there hasn't been progression, this is what I've had, then I've got a pretty clear diagnosis and the physical exam supports it, then traction alopecia works extremely, extremely well in terms of correction. So I encourage you to listen to my virtual consultation on traction alopecia, watch some of my before and after, look at my before and afters, and all those elements to give you a better sense of how this could be applicable for you. But traction alopecia, I get very, very high success rates with.